Hello and welcome to all. It's great to be here. My name is Penelope Boxall. I'm the Regional Manager for South East NHS England and Improvement, but please feel free to call me Penny. So here we are, traversing the COVID terrain and beyond. In the South East Engagement and Staff Experience team, our people and all the staff in the NHS and in social care are equal priority, and their health and wellbeing is paramount at all times. I want to echo what's already been said by colleagues across the region and the seniors in South East NHS England and Improvement, that we journey with staff to ensure that they are happy and healthy in work and that they stay in work. Happy and healthy staff means better patient outcomes. As Regional Manager, I work with the systems and the organisations in them to produce working environments that fully lend themselves to staff health and wellbeing. So we maintain a strategic overview by providing leadership, support and facilitation for a range of health and wellbeing initiatives. We communicate that in the health and wellbeing space via communities of practice, made up of organisation health and wellbeing leads, champions, and our colleagues in primary care. I dovetail this with my team members in the retention and culture space and colleagues in the South East leadership team. Now, these activities that we do mean that the NHS people plan and promises, which places all staff care at the pinnacle of what we do. It ensures that it touches all areas of working life, be that on site, working from home, or other arrangements. It is quite literally the before, after, and during, all the time and every time. So we've had many innovative and needed projects being delivered across our region, including app provisions, rest pods, welfare buses, support networks, mental health hubs, and trauma support, to name just a few. We take guidance and facilitate the provision for all staff offers from the national team, and we actively promulgate and support health and wellbeing, the guardians, the champions and the leads, and the really important health and wellbeing conversations. We have masterclasses, events, training, and we co-design meetings with colleagues across the region for the colleagues. All this has culminated quite beautifully in our health and wellbeing framework. It's a virtuous cycle. It sustains health and wellbeing, the fulfillment at work in relationships for staff, managers and leaders. It's backed by the collection and application of data insights, and it's there to produce happy, healthy environments in the working place. In the South East team, we model what we expect in our health and wellbeing space, retention and culture, so that staff and health wellbeing experiences are always being responded to, being bettered. We listen, we share and develop, and we also have consistency with other regions. We've got a whole host of things that we're doing at the moment, including winter wellbeing offers about to be updated. We have a vaccinators support signpost. We're building our communities of practice, example, champions and guardians for health and wellbeing. We're developing networks. We've got menopause coming up on the horizon. We want to operate in a speak up culture, one which has safe psychological spaces for people. We want to support critical care staff and those on the front line, like the ambulance sector. We all know that they're going through a really tough time. We respond to the needs of the protected characteristic groups, for example, disability and BME. We're also looking at initiatives for responding to domestic abuse reduction and prevention of violence, growing occupational health, and these are just a few examples. So just to close, I want to borrow from our regional director, Anne Eden. She indicated that we want and needed open and transparent cultures which enable us to bring our whole selves to work. By listening to all the voices, we get richer, more diverse, and hence more inclusive input, which betters our decisions and produces better patient outcomes. And that's where we began, patient outcomes. But we can't have patient outcomes to be better unless we have better health and well-being for our staff. And that's what we do and why we're here. Thank you.